Safer healthcare and patient responsibility. Patient safety is now recognized as the most important quality improvement activity in healthcare. This is partly in response to growing public and political alarm at incidents involving poor or dangerous practice. A famous report published in 2000 entitled "To Err is Human" highlighted the millions of U.S. patients who were seriously harmed during hospitalization and an estimated 98,000 who died as a result of medical errors. Our doctor heroes on TV, like Dr. Marcus Welby, are fictional medical superheroes of sorts who can use their intuition to solve medical-related conditions. Many patients like and expect doctors to solve their health problems for them. Even though doctors can be wrong. The doctor's recommendation of camels lasted until the early 50s, when the first indicators about smoking and its effects on health were surfacing. Then the doctors began to publicly distance themselves from any positive advertising for smoking, but not before many people were already addicted to cigarettes. Medical mistakes in a hospital setting include surgical errors, operating on the wrong patient, operating on the wrong body part. We've all heard bizarre, but unfortunately true stories of these mistakes happening. Despite the great deal of training that medical professionals receive, it's not always their technical skills that contribute to mistakes. More often, medical mistakes can be attributed to human error. Poor communication among members of a medical team can be a result of the authority gradient, where there's a failure of efficient and effective communication as a result of perceived authority or the hierarchy of medical team members. In a hospital situation, in surgery for example, there can be a lack of situational awareness, where members of the medical team lose track of time and eventually run out of time to do something that would save a patient. And confirmation bias. Nurses cannot always assume that a doctor of any grade is always correct, especially if they can see otherwise. In such situations, nurses have a duty to speak up on the patient's behalf. More than 1 million serious medication errors occur every year in U.S. hospitals. These errors include administration of the wrong drug, drug overdoses, and overlooked drug interactions and allergies. The errors occur for many reasons, including illegible handwritten prescriptions and decimal point errors. A friend of mine who works in the hospital told me she wouldn't go in there as a patient without a bodyguard. Surgical mistakes, teamwork dysfunction, and medication errors all make the hospital a scary place indeed. But I believe the bodyguard she was referring to is known as a patient advocate. What can patients do? Patients can make their own healthcare safer by being informed about their conditions and any medical procedures that they will undergo. A patient can be his or her own best advocate for safer healthcare. The Joint Commission is an independent, nonprofit organization whose mission is to continuously improve healthcare for the public. Their vision is that all people always experience the safest, highest quality, best value healthcare across all settings. The Joint Commission has several initiatives for patients to take an active role in making their healthcare safer. One initiative is the Speak Up campaign. As a patient, you can make your healthcare safer by being an active, involved, and informed member of your healthcare team. The Joint Commission's National Patient Safety Goals program is made up of a panel of widely recognized patient safety experts to advise the Joint Commission on different safety initiatives. One of the Joint Commission's National Patient Safety Goals for this year is to improve the accuracy of patient identification by using at least 2 patient identifiers when providing care, treatment, and services. This will help eliminate transfusion errors related to patient misidentification. Another goal for patient safety is to reduce the risk of healthcare-associated infections by implementing evidence-based practices to prevent healthcare-associated infections in the hospital setting. The most basic yet very important of these is hand-washing procedures. Shared decision models where patients take an active role in their healthcare decisions are evolving the practice of evidence-based medicine. Patients who are involved in decision-making tend to choose less aggressive treatments but still have favorable outcomes and are more satisfied with their care. The availability of medical information on the Internet encourages patients to take a more active role in healthcare decision-making. Informed consumers of healthcare can positively impact the safety of the care that they receive. In the end, though, it is not clear how many decisions most patients really want to make. President Obama, commenting about his own healthcare, states, "I'm a pretty well-educated layperson when it comes to medical care. I know how to ask good questions of my doctor," he said, but ultimately, he's the guy with the medical degree.